Hi, my name's Leanne Wells, CEO of the Consumers Health Forum of Australia. Well, we've seen the launch of the opt-out period, the 3-month opt-out period for My Health Record. That certainly triggered a lot of debate, a lot of lively debate in the community about what is shaping up to be a significant development for Australia's healthcare system. CHF have long supported a national electronic health record system. We think it's a good thing. We think it's fundamental reform and long overdue in terms of modernising our Australian healthcare system. People think healthcare operates in a way that's technologically enabled in a similar way to the banking industry, to the tourism industry, to the telecommunications industry, when that's actually not happening. So this is going to be a very important reform. As it builds, and it will build over time, it won't be perfect on day one, it will offer substantial improvements in pursuit of safe, effective, efficient and better coordinated healthcare. That matters a lot to every Australian. But most importantly, we think My Health Record can play a key role in improving patients' experience of healthcare. When many people report to us instances of disconnected care, information about them being shared among providers when that's actually not happening, duplicate tests having to be requested and paid for time and time again, this sort of system, this single repository for health information about you can only assist, can only be of benefit. Now with the widespread rollout of My Health Record, the public at large will be able to experience the advantages of a better connected system. CHF's also supported the move to an opt-out approach because we think a critical mass, a lot of people using the system, is going to be important to accelerate it becoming just a key part of how we do the business of healthcare in this country. But as we've consistently said on the public record, to our members, to government, the key, and there are several keys to success here. The first is awareness, that people know what they're signing up to, public trust and confidence in the system, and utilisation of the system. And that's utilisation by consumers and providers. And that's going to mean conversations and collaboration between consumers and health professionals. To coin a phrase from one of our colleagues at the Canterbury District Health Board in New Zealand, we need the whole system to be working for the whole system to work. That makes a lot of sense to me. But I think it's fair to say My Health Record will remain topical right through the opt-out period and beyond. That's why in the weeks ahead, CHF, with funding from the Australian Digital Health Agency, will be hosting a series of 6 information webinars in which consumers, clinicians, privacy experts, agency staff and other experts will speak directly with the audience firsthand and respond to questions from an online audience. You might be aware of the concerns raised in recent weeks about the security and privacy aspects of the opt-out process. We've taken those very seriously at CHF, and we're working with the agency, with other NGO groups and provider groups and the government to press for these concerns to be addressed. Unless these emergent concerns aren't addressed, we risk eroding the value of My Health Record. We risk the debate being on the wrong things, and that wouldn't be in the patient or community's interests. A development of the scale and ambition of My Health Record can't be expected to have a trouble-free start, but for the vast majority of Australians, the potential individual and national health benefits outweigh the risks that it may pose to privacy and security. Look at it this way, as one commentator on Twitter put it, we're balancing the potential harm of a potential privacy breach with the real harms and risks of clinical teams not having the right information to support care. Now that's not a hard decision to make in our view. So briefly, what are the benefits or the key advantages of My Health Records? Well, it's exactly that. It's a single electronic patient record, a personal Dropbox if you like, containing all your Medicare information about your treatments, medications, tests and test results, scans, allergies, immunisations and end-of-life wishes. Another benefit is that it will reduce the risk of medication mistakes. How often do we hear of patients being discharged from hospital on one medication regime and their GP not being aware of that and putting them on another medication regime? So that sort of sharing of information, that sort of single point of truth about what medications you're actually on is one very practical benefit of this. It'll also reduce the unnecessary duplication of tests and scans, and we know that's enormously frustrating to consumers. Not only do you have to go and have them repeated, but with out-of-pocket costs being such an issue for consumers these days, you're actually paying unnecessarily for duplicate tests, where if they're all in this one repository and under your control, can be accessed by your GP and others, such as specialists that are part of your care team, then that's a good thing. And importantly, as consumers, we'll gain access to health records that previously have been difficult for us to see. Discharge summaries, for example. So all up, we believe it'll help deliver more responsive, coordinated care services, and particularly so for those with complex and chronic conditions, by facilitating information sharing and information flow with consumer consent and control between patients and a range of clinicians that are part of their immediate care team. But this is an empowering tool as well. Consumers can be active partners in their own care. We all know the evidence about that. We all know that exercising choice and control can prompt us to be more engaged, to ask questions that we otherwise might not have, to be better informed and more likely to take up medical advice. But there are issues that we as individuals in the community need to really carefully weigh up. Now, Consumers Health Forum has a really broad membership. We maintain the benefits for people, or the main beneficiaries will be people with complex multiple chronic conditions, families with children, older Australians being cared for by their siblings. But we also know that there are several among our members who represent people with mental health problems and other stigmatising, for better or worse, stigmatising illnesses, who are understandably cautious. That's why whether you opt in or opt out will require serious thought and is a matter ultimately of individual choice. So from next Wednesday, the 8th of August, CHF will host a series of 6 webinars, as I said, to contribute to community understanding of My Health Record. We'll cover a range of themes, ranging from an overview, and then we'll do some drill down themes. We'll be drilling down into privacy and safety. That's particularly topical at the moment. We'll be looking at the benefits and the risks in detail, and we'll be looking at a number of other aspects that emerge about My Health Record as the opt-out period continues to roll on. All of those webinars will be live, they'll all be interactive, and they'll all involve conversations in real time with consumers, with clinicians, and a whole array of experts who are there, who we've assembled to be there to answer your questions and your specific concerns, and to discuss the opportunities that My Health Record brings. So we hope as many people as possible can join these webinars. They'll also be available on our YouTube channel. There is some more detail on our website about other background information you might want to have a look at and have a read of before you join in and participate in the webinar. That way we can make use of the time to ask the most salient questions that really need to be clarified or resolved for people. So we'd also encourage you on our website to send through in advance, so we can target the information for these webinars, any questions or issues or particular topics you'd like covered off. So thank you, and we look forward to bringing those webinars to you over the course of the next 6 to 8 weeks.